Understand the benefits of physical activity, exercise to health and well-being. What is physical activity? At a fundamental level, physical activity involves any movement of your body that uses your muscles and spends energy. One of the exceptional things about physical activity is that there are unlimited opportunities to spend energy via physical activity. Exercise is the miracle cure we've always had, but for too long we've neglected to take our recommended dose. Our health is now suffering as a consequence. This is no snake oil. Whatever your age, there's strong scientific evidence that being physically active can help you lead a healthier and happier life. People who exercise regularly have a lower risk of developing many long-term chronic conditions, such as heart disease, type 2 diabetes, stroke, and some cancers. Research shows that physical activity can also boost self-esteem, mood, sleep quality, and energy, as well as reducing your risk of stress, depression, dementia, and Alzheimer's disease. If exercise were a pill, it would be one of the most cost-effective drugs ever invented, says Dr. Nick Cabell, a health promotion consultant. Health benefits. Given the overwhelming evidence, it seems obvious that we should all be physically active. It's essential if you want to live a healthy and fulfilling life into old age. It's medically proven that people who do regular physical activity have 1. Up to a 35% lower risk of coronary heart disease and stroke, 2. Up to a 50% lower risk of type 2 diabetes, 3. Up to a 50% lower risk of colon cancer, 4. Up to a 20% lower risk of breast cancer, 5. A 30% lower risk of early death, 6. Up to an 83% lower risk of osteoarthritis, 7. Up to a 68% lower risk of hip fracture, 8. A 30% lower risk of falls among older adults, 9. Up to a 30% lower risk of depression, and 10. Up to a 30% lower risk of dementia. Increase your chances of living longer. Science shows that physical activity can reduce your risk of dying early from leading causes of death, like heart disease and some cancers. This is remarkable in 2 ways. Only a few lifestyle choices have as large an impact on your health as physical activity. People who are physically active for about 150 minutes a week have a 33% lower risk of all-cause mortality than those who are physically inactive. You don't have to do high amounts of activity or vigorous intensity activity to reduce your risk of premature death. Benefits start to accumulate with any amount of moderate or vigorous intensity physical activity. The Center for Disease Control give the benefits for children, adults, and healthy aging. Benefits for children. Reduces risk of depression. Improves aerobic fitness. Improves muscular fitness. Improves bone health. Promotes favorable body composition, and improves attention and some measures of academic performance with school physical activity programs. Benefits for adults. Lowers risk of high blood pressure. Lowers risk of stroke. Improves aerobic fitness. Improves mental health. Improves cognitive function. Reduces arthritis symptoms, and prevents weight gain. Benefits for healthy aging. Improves sleep, reduces risk of falling, improves balance, improves joint mobility, extends years of active life, helps prevent weak bones and muscle loss, and delays onset of cognitive decline.